Welcome to Bernade channel. Thank you for joining us. Today, we'll discuss a comprehensive nursing care plan for hyperthermia, including prevention, recognition, and management strategies for healthcare professionals. Nursing diagnosis: hyperthermia. Related to excessive environmental heat exposure, impaired thermoregulation, vigorous physical activity in hot environments, certain medications, example anticholinergics, diuretics, dehydration, endocrine disorders, example thyrotoxicosis, infections or inflammatory processes as evidenced by core body temperature above 38 degrees Celsius 100.4 degrees Fahrenheit, hot, dry skin, in heat stroke, or profuse sweating, in heat exhaustion, tachycardia and tachypnea, headache, dizziness, or vertigo, altered mental status, confusion, or delirium, nausea and nursing diagnosis: hyperthermia. Vomiting, muscle cramps or weakness. Desired outcomes: 1. The patient will achieve and maintain a normal core body temperature, 36.5 degrees Celsius to 37.5 degrees Celsius or 97.7 degrees Fahrenheit to 99.5 degrees Fahrenheit, within 2 hours of intervention initiation. 2. The patient will demonstrate stable vital signs and improved mental status within 4 hours. 3. The patient will verbalize understanding of hyperthermia prevention strategies and demonstrate appropriate self-care behaviors within 24 hours. 4. The patient will show no signs of complications related to hyperthermia, example organ failure, rhabdomyolysis, throughout the hospital stay. Nursing interventions and rationales: 1. Assess and monitor vital signs, especially core body temperature, every 15 to 30 minutes initially, then hourly as condition improves. Use rectal, esophageal, or bladder temperature monitoring for accuracy in severe cases. Rationale: provides crucial information about the severity of hyperthermia and the effectiveness of cooling interventions, allowing for timely adjustments in treatment. 2. Implement rapid cooling measures. A. Remove excess clothing and apply cool, wet sheets to the body. B. Use ice packs on neck, axillae, and groin areas. C. Employ nursing interventions and rationales: evaporative cooling techniques, misting water on skin while fanning. D. Consider cold water immersion for severe cases, if facilities available. Rationale: rapidly reduces core body temperature, preventing further heat-related organ damage. Target cooling rate is 0.15 degrees Celsius to 0.30 degrees Celsius per minute until temperature reaches 39 degrees Celsius. 3. Administer intravenous fluids as prescribed, typically normal saline, to correct fluid and electrolyte imbalances. Rationale: restores intravascular volume, supports organ perfusion, and aids in temperature regulation. Monitor for nursing interventions and rationales: signs of fluid overload. 4. Provide supplemental oxygen as needed and monitor oxygen saturation levels. Rationale: ensures adequate oxygenation, as hyperthermia increases metabolic demands and can lead to respiratory distress. 5. Administer prescribed medications. A. Antipyretics, example acetaminophen, for fever-induced hyperthermia. B. Benzodiazepines for severe shivering or agitation. Rationale: addresses underlying causes and symptoms of hyperthermia. Note: Antipyretics may not be effective in non-fever related hyperthermia. 6. Monitor for and manage nursing interventions and rationales. Potential complications: A. Check serum electrolytes, creatinine, and liver function tests. B. Monitor for signs of rhabdomyolysis, dark urine, muscle pain. C. Assess for signs of disseminated intravascular coagulation. D. Rationale: early detection and management of complications can improve outcomes and prevent organ failure. 7. Educate the patient and family about A. Risk factors for hyperthermia, example high environmental temperatures, certain medications. B. Early signs and symptoms of heat-related illnesses. C. Preventive measures, adequate hydration. Nursing interventions and rationales: appropriate clothing, avoiding peak heat hours. D. Importance of gradual acclimatization to hot environments. Rationale: empowers patients and families to prevent recurrence and seek timely medical attention when needed. Evaluation: 1. The patient's core body temperature is maintained between 36.5 degrees Celsius and 37.5 degrees Celsius, 97.7 degrees Fahrenheit to 99.5 degrees Fahrenheit, for at least 24 hours without intervention. 2. The patient demonstrates stable vital signs, including heart rate 100 bpm and respiratory rate 20 breath/min. 3. The patient's mental status returns to baseline, with no signs of confusion or delirium. 4. The patient verbalizes understanding of hyperthermia prevention strategies and demonstrates appropriate self-care behaviors. 5. Laboratory values, electrolytes, renal and liver function tests, remain within normal limits or show improvement. 6. Evaluation: the patient shows no signs of complications related to hyperthermia throughout the hospital stay and follow-up period. Important notice: this presentation is for educational purposes only and should not replace professional medical advice. Always consult a healthcare provider for diagnosis and treatment of hyperthermia and other heat-related illnesses. For more comprehensive information on various medical topics, download the Burn8 app for free from the Play Store or App Store, featuring answers to over 3,000 medical questions.